Hi, hello friends, good morning. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a new subject from the nursing. Subject name is Psychiatric and Mental Health Nursing. We will discuss not only FAQ in the mental health nursing subject onwards. Additionally, we will discuss regarding subject introduction and important topics or medical terms related to the conditions. Till now, we are successfully finished. These all are the subjects name I will mention now: nutrition, anatomy and physiology, medical surgical nursing, and also fundamentals of nursing, midwifery and gynecology point of view. And additionally, we already discussed the one of the model paper. Recently we already discussed each subject and model paper. We already covered each subject 100 questions and answers with explanation. We already finished in previous videos. Today we are going to discuss mental health nursing. Before moving on to topic, a small request friends. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. What I'm expected likes are not coming for my videos. Please friends, like a video. While watching a video, please 1 second give a like and comment, please friends. Let's move on to topic. Today we are going to discuss mental health and psychiatric nursing. This is part 1 we are going to discuss today. From the mental health psychiatric nursing, we are going to discuss briefly these all are the topics now. First point of view, what is psychiatry, what is mental health nursing, who is father of psychiatry, and who is first psychiatric nurse. We will see first these all things first. What is psychiatry? Psychiatry is the branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavior disorders. Psychiatry is the branch of medicine focused on the diagnosis and treatment, prevention of mental, emotional, and behavior disorders. Means relating to the disorders of mind, mental, and psychogenic and psychological behavioral disorders. This is the psychiatry. Meaning of psychiatry. This is the definition. Now, what is mental health nursing? The primary role of a mental health nurse is to provide care to patients with psychiatric disorder, mental health issues, or behavior problems. The nurse have to provide a care to patients with psychiatric disorders, those who are having psychiatric disorders, the patient caring, and mental health issues. Anybody having mental health issues, the nurse have to provide care to them. And also behavior problems. The person is having behavior problems, mental and psychiatric disorders. The nurse have to play a primary role of mental health nurse to provide care to the patient. This is definition of the mental health nursing. Who is father of psychiatry? Father of psychiatry is Dr. Benjamin Rush. One of the important question friends, who is father of psychiatry? And another question also we will get like this, who is father of modern psychiatry? That's why I am explaining briefly in before the question FAQs, questions and answers. Who is father of psychiatry means Dr. Benjamin Rush. Who is father of modern psychiatry means Philippe Pinels. He is father of modern psychiatry. Father of psychiatry means Dr. Benjamin Rush. Father of modern psychiatry means Philippe Pinels. Father of psychiatry Dr. Benjamin Rush, the father of American psychiatry. He was the first to believe that mental illness is a disease of the mind. So, he is father of psychiatry. He is father of psychiatry in American first. He is father of American. Who is father of India in psychiatry? In India, the father of psychiatry is M. Sarada Menon, born 5th April in 1923. Remember friends, father of psychiatry in America means he will come. Who? Benjamin Rush. In India means M. Sarada Menon. Here we can see in this screen who is first psychiatric nurse. The first psychiatric nurse Linda Richards. Linda Richards, first psychiatric nurse in 1873. This is also one of the FAQ, means this is also we will get in the exams one of the question. Here we can see the psychiatric disorders. Classification of mental disorders are considered as a disturbance of any one of the following areas. Those are cognition, conation and affect. Cognition means thoughts. Conation means action. Affect means feelings. Cognition is defined as the mental action or process of acquiring knowledge and understanding thoughts, experience and senses. Conation means a mental faculty of purpose, desire, will to perform an action. Third one, affect. Affect means feeling. Emotion exists of the sake of actions and dealing with the environment. These all are the psychiatric disorders. Any imbalance between these above three factors, in a simple way, these disorders are classified as we will see now. These disorders are classified like organic mental disorders, non-organic mental disorders, personality disorders, psychosexual disorders, stress related disorders, psychomatic disorders and mental disorders to psychoactive substances abuse and child psychiatric disorders, other disorders. Now we will discuss briefly these all are the disorders related to the conditions. First one we will see organic mental disorders. Organic mental disorders, psychiatric disturbances resulting from transient or permanent central nervous system dysfunction. The disorders are caused by underlying brain pathology. These are classified into delirium and dementia. The organic mental disorders are delirium and dementia. What is delirium? Delirium is a acute organic mental disorder. It like acute onset presence of disorientation, anxiety, poor attention and drowsiness. Perceptual abnormalities are common and reversible. Next, what is dementia? Dementia is a chronic organic mental disorder. Insidious onset disturbances, memory loss and impairment of consciousness and global impairment of cerebral function, mostly reversible. This is delirium and dementia. Delirium and dementia both are organic mental disorders. This is the delirium and dementia. Now we will see non-organic functional mental disorders. Non-organic mental disorders are classified into psychotic disorders and neurotic disorders. Psychotic disorders are, for example, schizophrenia, mood disorders and delusional disorders. And second thing, neurotic disorders. Neurotic disorders are anxiety disorders, phobic and hysteria and OCD, obsessive compulsive disorder. These all are the non-organic mental disorders. Now briefly we will see what is schizophrenia, what is mania. Schizophrenia is a group of mental disorders characterized by disorganization of the personality. Its symptoms like interfering with the patient thinking, emotions and behavior. Schizophrenia is a group of mental disorders characterized by disorganization of the personality and also symptoms like the patient having interfering thinking and emotions and behaviors also interfering of these all are the behaviors. Next, what is mania? Mania means extremely elevated and excitable mood usually associated with bipolar mood disorder. And also mania is a suffix denoting pathological preoccupation with some desire, idea or activity. A morbid compulsion. Some of the frequently encountered manias are dipsomania, kleptomania and nymphomania and also pyromania. These all are the types of manias. In additionally, we can discuss here the schizophrenia clinical features. Disturbances of thinking, disturbances of emotions and disturbances of behavior, disturbances of perceptions, disturbances of mortality and attention, poverty of ideas, thoughts and block fights of movements means flights of ideas, emotional blunting, hypersensitivity, criminal activity, hallucinations, illusions, and excitement, violent behavior. These all are the clinical features of schizophrenia. Here we can see the personality disorders, psychosexual disorders and stress related disorders, psychomatic disorders and mental disorders to psychoactive substances abuse and child psychotic disorders. Here we can discuss especially child psychotic disorders. Child psychotic disorders are autism, attention deficit disorder, conduct disorders and slow learners, school phobia, neurosis, child abuse and other disorders. And ninth one, other disorders. Other disorders like epilepsy, psychiatric accepts and psychiatric disturbances in women and psychiatric disturbances in adolescents, psychiatric disturbances in old age. This is the introduction of psychiatric and mental health nursing. Now we will discuss FAQ related mental health and psychiatric nursing. Question number 1. Melancholia means. What is melancholia? We will see now options. Option A, mentally healthy person. Option B, mania. Option C, schizophrenia. Option D, depression. What is melancholia? Melancholia, the word melancholia has been used since the time of ancient Greek to describe feeling intensely sadness and hopelessness. Some of the times melancholia is also called as melancholic depression or also known as major depression with melancholic features, usually severe illness. Like here option D, depression is there. So melancholia means depression. We will discuss all of the options here. Mentally healthy person means normal person only. We will see next option B, mania. Mania means extremely elevated and excitable mood usually associated with bipolar disorder. Not this one. Option C, schizophrenia. Schizophrenia is a disorder that affects person ability to think, feel and behave clearly. Means this is not condition. Melancholia depression is also called as depression. In detail we will see now. One type of depression is sometimes known as melancholia. Melancholia depression is usually severe. Most people with melancholia depression experience slowing down of their speech, thoughts and movements. Depression is a group of conditions associated with elevation or lowering of person's mood, such as depression or bipolar disorder. So here option D, depression is correct answer. Next we will move on to question number 2. Indications of psychotherapy. What are the indications of psychotherapy? We will see now options. Option A, anxiety neurosis. Option B, psychosomatic illness. Option C, schizophrenia, depression, mania. Option D, all of the above. Before discussion of the options, what is psychotherapy we have to know. Psychotherapy refers to a variety of treatment that aim to help a person identify and change troubling emotions, thoughts and behaviors. We are having 4 types of psychotherapies. Now we will discuss now. First one, cognitive behavior therapy. Second one, psychodynamic therapy. Third one, dialectical behavior therapy. Fourth one is experimental therapy. These all are the 4 types of psychotherapies. Now we will see indications of psychotherapy now. Option A, anxiety neurosis. What is anxiety neurosis? Anxiety neurosis is a mental health disorder characterized by feelings of worry, anxiety or fear that are strong enough to interfere with one's daily activities. So here the anxiety neurosis is one of the anxiety disorder. Patient having anxiety and fear feels of worry. Next option B. What is psychosomatic illness? Psychosomatic illness, people with this condition may have excessive thoughts, feelings or concern about the symptoms which affects their ability to function well. Means the psychosomatic illness patient is having excessive thoughts and feelings. So this is the psychosomatic illness. Option C, schizophrenia, depression, mania. What is schizophrenia? Schizophrenia and mania and depression. These conditions we already discussed in first question. So here indications of psychotherapy will come all of the above. Why psychotherapy have to done in a patient? Psychotherapy indications like anxiety disorders such as OCD, obsessive compulsive disorders, and panic disorders, phobias, most traumatic stress disorders, mood disorders like depression and bipolar mood disorders, and addictions disorders like alcoholism and drug dependence conditions, and eating disorders like anorexia and bulimia nervosa. The main aim of the psychotherapy is to help build self-esteem and reduce anxiety and to improve a social and community functions. These all are the aims of the psychotherapy. The indications of psychotherapy here will come anxiety neurosis, psychosomatic illness and schizophrenia, depression, mania. These all are the condition we can go for psychotherapy. Next we will move on to question number 3. Among the following, which one is a delusional disorder? We will see here options. Option A, trance. Option B, Capras syndrome. Option C, dissociative fag. Option D, Ganser's syndrome. What is delusional disorder? Delusional disorder is a type of psychotic disorder. For example, schizophrenia for the delusional disorder. Here we will discuss. First, we will discuss options first. Option A, trance. What is the meaning of trance? Trance means an altered state of consciousness. Nothing but altered state of consciousness. Option B, Capgras syndrome. Capgras syndrome is false belief and delusional misidentification syndrome. Capgras syndrome means false beliefness and also delusional misidentification syndromes is there here. Next, option C, dissociated fag. What is dissociative fag? Dissociative fag means it is a temporary state where a person has memory loss, means amnesia, and ends up in an unexpected place. Means the temporary state where the memory loss related to the unexpected place. People with these symptoms cannot remember who they are in detail about their past. In their past life, who is there, they will not remember in this condition, dissociated fag. What is Ganser's syndrome? Ganser's syndrome is a rare and controversial condition whose main and most striking features is the production of approximate answers to very simple questions. Means they will give controversial condition and they will give answer related to the simple questions. And Ganser syndrome associated with a no symptoms were also reported. The clouding of consciousness, hallucinations, sudden and spontaneous recovery, acute psychotic illness such as schizophrenia we can see in this Ganser's syndrome. Here we already discussed delusion disorder, means it is one of the psychotic disorder. For example, schizophrenia. So here option D, Ganser's syndrome is the correct answer. Next we will move on to question number 4. Sleepwalking is also termed as. Sleepwalking also known as, we will see here options. Option A, somnambulism. Option B, bruxism. Option C, sleep terror. Option D, apraxia. First we will discuss the options now. Somnambulism. Somnambulism is also known as sleepwalking, involves getting up and walking around while in a state of sleep. Most common in children than adults. Causes are stress and anxiety. One of the disorder, sleeping walking also, means sleepwalking is termed as somnambulism. Option A here correct answer, but we will discuss other options also. Option B, bruxism. Bruxism is involuntary habitual grinding of the teeth. Typically during the sleep this will be happen. The causes of bruxism: too much of stress and anger, pain and also frustration. Some of the frustration conditions also, the grinding of the teeth will happen. Next, what is sleep terror? Sleep terror, night terrors, also called as sleep terror, episodes of screaming, intense fear and fainting while still asleep, often paired with a sleepwalking also. Some of the conditions, sleep terrors, they will walk in the sleep also. What is apraxia? Apraxia is the loss of ability to execute or carry out skilled movement and gesture. Apraxia is a neurological disorder characterized by inability to perform familiar movements and command. So, here the sleepwalking is also termed as option A, somnambulism. Next, we will move on to question number 5. Common risk of severe depression is. The common risk of severe depression is, we will see here options. Option A, suicide. Option B, hallucinations. Option C, fatigability. Option D, thought black. Depression is a group of conditions associated with elevation or lowering of person's mood, such as depression or bipolar disorder. Here, in this condition, what are the risk will come in the severe depression situation? We will see here options. Option A, suicide. Option B, hallucination. Option C, fatigability. Option D, thought black. We will discuss one by one. Option A, suicide. Major depression is a psychiatric diagnosis most commonly associated with suicide. Lifetime risk of suicide among of patients with untreated depressive disorder nearly 20%. So here common risk of severe depression is suicide. Option A is the correct answer, but we will discuss other options also. Option B, hallucinations. Hallucinations, a perception of having seen, heard, touched, tasted or smelled something that wasn't actually there. What is the meaning of hallucination? Means nobody is there in front of that person. They will feel, means they will perceive having seen one person, or we are having something through the ears and I am seeing something like that. They feel, that is the perception of hallucination. What is fatigability? Fatigability is a tendency to get tired or loss of strength. That is the fatigability. Nothing but fatigue. Thought black. Thought black means it is occurs when someone is talking and suddenly stops for no clear reason. Somebody will talk continuously and unexpectedly they will stop without reason. That is called as thought black. For example, the causes of the thought black is schizophrenia, anxiety, aphasia and dementia. These all are the conditions causes for the thought black. Here the common risk of severe depression is option A, suicidal tendency is severe depression condition we can see. Next we will see the question number 6. The drug of choice in alcohol induced psychosis. First we have to know what is psychosis. What is alcohol induced psychosis? Psychosis means it is one of the psychotic disorder, a mental disorder characterized by a disconnection from the reality. This is the psychosis. Means the patient is having disconnection from the reality. This is the one of the mental disorder. What is alcohol induced psychosis? Alcohol induced psychosis is symptoms of psychosis present during or shortly after heavy alcohol intake. Clinically, alcohol related psychosis is similar to schizophrenia but has been found to be unique and independent condition. It is characterized by hallucinations, paranoia and fear. These all are the characteristics. The drug of choice for alcohol induced psychosis. We know what is the psychosis now. We know what is the alcohol induced psychosis now. We will see first options now. Option A, diazepam. Option B, haloperidol. Option C, imipramine. Option D, none of the above. What is diazepam? Diazepam is used to treat anxiety muscle spasm and seizures or fits. Also used in hospital to reduce alcohol withdrawal symptoms only. Not in psychiatric condition. The diazepam is used to treat anxiety, muscle spasm and some of the conditions seizures, and also used in hospitals to reduce alcohol withdrawal symptoms. This is diazepam. Here, so the drug of choice for alcohol induced psychosis, not diazepam. Next we will see further options. Option B, haloperidol. Haloperidol is first generation of antipsychotic drug. So here we got antipsychotic drug. In the name, haloperidol is a first generation of antipsychotic drug that is a commonly used drug in worldwide. Haloperidol is used to manage positive symptoms of schizophrenia such as hallucinations and delusional disorders, and also drug of choice for alcohol induced psychosis. So here we got answer. The drug of choice of alcohol induced psychosis means haloperidol. We will see option C also. Imipramine. Imipramine is in a class of medications called as tricyclic antidepressants. The drug treatment is depression by increasing the amount of certain natural substances in the brain that needed to maintain a mental balance. The impiramine is a treatment of depression and anxiety. The drug of choice here, alcohol induced psychosis, haloperidol, we already discussed. Option B is the correct answer here. Next, move on to question number 7. A newly admitted client has started taking bupropion. A newly admitted client has started taking bupropion or wellbutrin. The nurse monitors in which of the following side effects that would indicate an overdosage of medication. The patient is admitted in the hospital, started to take bupropion medication. The nurse have to monitor which of the following side effects due to the overdosage of medications. We will see here options. Option A, headache. Option B, dizziness. Option C, constipation. Option D, seizures. Here no need of explanation regarding the options, but we have to know what is the medication of bupropion or wellbutrin. Wellbutrin or bupropion is an antidepressant medication used to treatment major depressive disorder and seasonal affective disorder. Overdose symptoms may include like seizures, muscle stiffness, hallucinations, and fast or uneven heartbeat, shallow breathing, and also headache, dizziness, constipation are common side effects of the bupropion. But the first foremost thing, the side effects due to the overdose of the medication is seizures. Option D is the correct answer. Here headache, dizziness, constipation, these three all are the effects due to the medications, common side effects. So here option D, seizures, is the correct answer. Next we will move on to question number 8. Common signs of depression are except. The common signs of depression are all except means from the option the signs of the depression is except condition. We will see here option A, apathy. Option B, sadness. Option C, hopelessness. Option D, increased psychomotor activity. What is apathy? Apathy means a feeling of not being interested in or enthusiastic about anything. So here the person will not feel anything interested. This is the apathy. Sadness means the depressive patients automatically they feel sadness, and also hopelessness also one of the signs and symptoms of the depressive patients. Here apathy is there, sadness is there, hopelessness is there. These all are the signs of the depressive patient. Option D, increased psychomotor activity, is the accept signs of depression here. What is increases psychomotor activity? Due to this what will happen we will see now. Due to the increased psychomotor activity will occurs with mania or anxiety and also bipolar disorder. These all are the condition will happen increased psychomotor activity due to this. The common signs of depression we will see now. Related to the mood, the signs of depression is anxiety, apathy, sadness, guilt, hopelessness and loss of interest and also mood swing behavior, and sadness related to the sleep, insomnia, early awaking, restlessness, sleeplessness, and also whole body will fatigue and loss of appetite, restlessness, behavioral symptoms like agitation, irritability, excessive crying and social isolation, and also we can see weight gain or weight loss and suicidal thoughts also we can see the depression patient. Here option D is the except. Here common signs of depression is increased psychomotor activity. Next we will move on to question number 9. Contraindication for group therapy. What is group therapy? We will see now. Options: option A homogeneous group, option B patient with personality disorders, option C antisocial patients, option D families and couples. What is group therapy? We have to know first. Group therapy is a form of psychotherapy that involves one or more therapists working with several people at a same time. Means group therapy is form of a psychotherapy. What is psychotherapy? We already discussed in second question related to the psychotherapy. We already discussed. Group therapy means group therapy is a treatment of multiple patients at one by one or more healthcare providers. We can provide group therapy. We will see here what are the contraindication for group therapy. We will see option A homogeneous group. Homogeneous group means might include who are same age and socio-economically same background. Means here homogeneous means same age group and socio-economically same background. Here option B we will see patient with personality disorders. Patient with personality disorders means schizoid personality and paranoid personality. Here antisocial patient means patient is in antisocial means in the community areas. Option D families and couples. Families and couples means family means the patient relatives and primary and secondary people related to the patient, and couples means we all know what is the couples. The what we will see now first indication, not only contraindication we will discuss here, additionally indications also. Indications for group therapy: patient is on pharmacotherapy and psychotherapy, mild to moderate major depression patients, mild to moderate anxiety disorders and bipolar disorders. These all are the indication for the group therapy. Now we will see what are the contraindications for group therapy. The contraindications for group therapy is psychosis, for example psychotic depression, mania and schizophrenia, and also organic mental disorders like dementia. Antisocial personality patients like poor psychosocial insight. Here we got antisocial patient in contraindication. So here in this option, option C is there, antisocial patient. The contraindication for group therapy is option C, antisocial patients. Here we got the answer. Next we will move on to question number 10. Which among the following drug is not used to treat the side effects of antipsychotics? Here from the options, the drug is not used to treat the side effects of antipsychotics. We will see here options. Option A anticholinergics, option B antibiotics, option C antihistamines and option D amantadine. We will see here option A anticholinergics. Anticholinergics is to treat or to help to prevent unwanted extrapyramidal side effects often associated with antipsychotic drugs. So here we can use antipsychotic drugs for anticholinergics. Next, what are the drugs we are using for anticholinergics in antipsychotic side effects. For example, anticholinergic drugs are amantadine, benzotropine, piperidine, and promethazine. These are the anticholinergics we can use for the antipsychotics. Option B, antibiotics. Antibiotics, antimicrobial components we can use for the antibiotics. Here option B also we can use for the antipsychotic side effect purpose to treat a psychotic side effects. Next option C, antihistamines. Antihistamines used to relieve symptoms of allergics such as fever, aches, and conjunctivitis and reaction to the insect bites. Short-term treatment of insomnia. For example, drug antihistamine is Bendadryl. Here we can't use the antihistamines to treat the side effects of antipsychotics. So here option C is not used to treat the side effects of antipsychotic drugs. Option C is the correct answer here. Next option D, amantadine. Amantadine is one of the drug of anticholinergics. So here option A, B, D, these three medications we can use for the treatment of side effects for the antipsychotic. Except antihistamines we can use these all are the medications. Next we will move on to question number 11. Which of the following is not a recommended preparation for ECT procedure? Electroconvulsive therapy. Which of the following not recommended preparation for the procedure? We will see here options. Option A, administration of an anticonvulsant 30 minutes before electroconvulsive therapy. Option B, morning bath, cleaning the oil to the head, overnight fasting. Option C, pre-ECT investigations. Option D, informed consent. What is ECT? We have to know first. ECT means electroconvulsive therapy. It is a procedure done under the general anesthesia in which small electric currents are passed through the brain, intentionally triggering a brief seizures. So this is electroconvulsive therapy. What is the aim of ECT? The aim of ECT is to relieve the symptoms of some mental health problems. The main aim of ECT is to treat symptoms of mental health problems. ECT is performed under general anesthesia, should not drink after midnight on the day of treatment. NPO to be done. NPO means nothing per oral from the midnight onwards. So we have to keep patient throughout night from the midnight 12 o'clock onwards. From the midnight onwards we have to keep NPO to the patient. One more thing, effect on ECT. Anticonvulsant effect on ECT treatment. Recommended action, anticonvulsants potentially reduce effectiveness of ECT. If we are using the anticonvulsants medication means the patient will compress the convulsions. So here we have to hold the anticonvulsants medications. So we have to withhold the dose the night before ECT midnight dose. We have to hold the dose. And also pre-ECT investigation to be done, medical health examination and complete physical examination to be done, and psychiatric assessment compulsory mandatory to be done. Informed consent to be taken before the ECT procedure. That is also one of the important procedure. And also one more thing I have to include here, procedure is under the general anesthesia, so we have to inform anesthesia team also. Option A, administration of an anticonvulsant 30 minutes before ECT is not recommended preparation for ECT procedure. So this is the except here, this is not applicable for the ECT procedure recommendation. Next we will move on to question number 12. Agoraphobia is characterized by. What is the meaning of agoraphobia? Agoraphobia is an anxiety disorder develops one or two more panic attacks. This is the meaning of agoraphobia. We will see here options now. Option A, fear of closed place. Option B, association with schizophrenia. Option C, fears of lifts and heights. Option D, often association open space with panic attacks. Option A, fear of closed place. Fear of closed place means claustrophobia. Claustrophobia means fear of closed place. Option B, associated with schizophrenia. Schizophrenia means a disorder that affects person ability to think, feel and behavior clearly. This is one of the condition related to the psychotic disorder. So here option A, fear of closed place means claustrophobia associated with schizophrenia, not there here. Next we will see option C. Option C, fear of lifts and heights. Acrophobia is also called as fear of lifts and height. So here option A and B, C. These all are the not involved the characteristic of acrophobia. Here option D, often association open space and with panic attacks. Agoraphobia means is a anxiety disorder develops one or more panic attacks. Here option D is the correct answer. Here agoraphobia is fear of places and situations that might cause panic and helplessness. Here option D is the correct answer. Next we will move on to question number 13. During a hypertensive crisis, the nurse makes sure which of the medicine is readily available. During the situation of hypertensive crisis, the nurse have to make sure the medicine to be ready. Which of the medicine from the options? We will see here option A, phenobarbital sodium, option B, phentolamine, option C, diazepam, option D, lithium citrate. We will see one by one options. Option A, phenobarbital sodium. Phenobarbital sodium is used to treat or control seizures. Phenobarbital is also used to relieve anxiety. It is also used to prevent withdrawal symptoms of the patient. So this is not included into the hypertensive medication. Next we will see option B, phentolamine. Phentolamine is a non-selective alpha adrenoceptor antagonist. It is used to treat hypertensive crisis. So the drug of choice here, hypertensive crisis, the nurse have to make sure the medicine is ready to available is phentolamine. Option phentolamine. Option B is the correct answer here. Next we will discuss further medicines also. Option C, diazepam. Diazepam we already discussed in 6th question, the drug of choice for alcohol induced psychosis. In that question we already discussed related to the diazepam. Next we will see option D, lithium citrate. What is lithium citrate? Lithium citrate is a chemical compound of lithium and citric acid that used as a mood stabilizer in psychiatric treatment of manic states and bipolar disorders. The drug lithium citrate is used to treat mood stabilizer like mania and bipolar disorder. So here hypertensive crisis, the first line treatment for hypertensive crisis will typically be IV antihypertensive medication to lower the person's blood pressure and to prevent further organ damage. Phentolamine is used as an antidote for a hypertensive crisis. So here option B is the correct answer. Next we will move on to question number 14. Most common cause of dementia. Here what is the most common cause of dementia? We will see here options. Option A, stroke. Option B, Parkinson's disease. Option C, Alzheimer's disease. Option D, none of the above. Here what is dementia? We have to know. Dementia related to the introduction and definition of the dementia we already discussed in this video only. Introduction of the mental health nursing already discussed related to the dementia. We will discuss clearly options first. What is stroke? We will discuss now. Stroke is nothing but CVA, cerebrovascular accident, the damage to the brain from interruption of its blood supply. A stroke is a medical emergency, not psychiatric condition. So here stroke will not come for the cause of dementia. Next we will see option B. What is Parkinson's disease? Parkinson's disease is a disorder of the central nervous system that affects movement, often including tremors. So here central nervous system that affects movement often includes tremors means Parkinson's disease is related to the effects of movements and tremors. So option B, Parkinson's disease also not cause for the dementia. Next option C, we will see Alzheimer's disease. Alzheimer's disease is also called a senile dementia, a progressive disease that destroying memory. So the dementia is related to the Alzheimer's disease. Alzheimer's disease also called as senile dementia. So here the most common cause of dementia is Alzheimer's disease. In detail about dementia, common cause in Alzheimer's disease we will see now. The dementia is a chronic organic mental disorder, and also dementia is like a dying mind in living body. The 5% of population aged over 65 years and 10% those aged are over 80 years. These all are the age groups are more suffering with dementia. Dementia caused by damage to or changes in brain. Alzheimer's is the most common cause of the dementia. Here option C is the correct answer. Next we will move on to question number 15. A false perception is known as. The false perception is known as, we will see here options. Option A, illusion. Option B, delusions. Option C, hallucinations. Option D, all of the above. First we will see illusions. Illusion is a false idea, belief or impression, also called as false perception. We are having three types of illusion. Those are optical illusions, auditory illusions and tactile illusion. Optical illusions means while seeing through the eyes. Auditory means while hearing through the ears. Tactile illusions means while talking. So illusions also one of the false perception. So here option A is the correct. Next we will see further options. Option B, delusion. A delusion is a belief that has no evidence in fact, a false belief. So delusion is also one of the false perception disease. Next option C, hallucinations. Hallucinations, seeing or hearing something that is not really there. So hallucination is a false perception of objects or events, involves sense, sight, sound, smell, touch and taste. So here option C also one of the false perception. So here illusion, delusion, hallucination, three are referred to false perception or idea. So here option all of the above is the correct answer. Next we will move on to next question, question number 16. The incidence of schizophrenia in very high in. The incidence of schizophrenia cases which are the having high incidence. We will see here options. Option A, normal child. Option B, uniovular twins. Option B, biovular twins. Option D, all of the above. Here normal children most probably they will not get incidence of schizophrenia. Next we will see option B, uniovular twins. What is uniovular twins? We have to know first. Uniovular twins means twins that develop from same ovum and they will be same sex after birth also. Means uniovular twins means identical twins and single egg and single sperm they will develop from same ovum and one sperm and one ovum they will develop two twins. So here uniovular means we got. Next what is biovular twins? Biovular twins means twin will develop from two different ovum. So this is called as twin biovular twins. It is non-identical some of the cases identical. So here Uniovular twins is most common instance of schizophrenia. We can see very high. Previous studies shows that schizophrenia affects both members of identical twins or uniovular twins 41% to 61% of cases, but only 0 to 28% in biovular cases. Twin studies have suggested that the hereditary of schizophrenia is 8% cases. Okay friends, uniovular twins is having 41 to 61 percentage. Biovular twins is having risk of 0 to 28%. But twins, normal hereditary normal twins is having schizophrenia incidence rate is 8% only. So here incidence of schizophrenia is having very high in uniovular twins. Option B is the correct answer here. Next we will move on to question number 17. Find the example of primary group in the following. We already discussed related to the group therapy. And here note group therapy, find the example of primary group. Here we are having groups, primary group, secondary group and tertiary group in the communication purpose. Here we can see what is the primary group from the following options. Option A family, option B factory, option C party and option D playground. Here the primary group will come families and close friends, for example, for the primary group. So here option A family is the primary group in the options. Next, goal of primary groups is actually is relationship to themselves and rather than achieving same other purpose. So here the relationship and communication they have to improve through the groups. Next, what is the second group? Second group is university class friends and athletic class friends and workers in office. So here there is option 1 is there in families. Option 1 is the primary group in the following options. Next we will move on to question number 18. Contraindications for ECT. The contraindications for electroconvulsive therapy. We will see here options. Option A, disease of heart, kidney, lungs. Option B, first trimester of pregnancy. Option C, fractures of osteomalacia. And option D, all of the above. We already discussed related to the electroconvulsive therapy in question number 11 in detail. We already discussed. Here only we will discuss related to the ECT, electroconvulsive therapy, indications and contraindications we will discuss here. First we will see here the indications of electroconvulsive therapy. The indications for the ECT are patients with treatment of resistant depression, acute illness, suicidity means severe suicidal tendency, failure to respond to multiple antidepressant medication trials. These all are the indications for ECT. Now we will see the contraindications for ECT. Elevated intracranial pressure and space occupying lesions in the brain and diseases of heart, kidney, lungs and hypertension. First trimester of pregnancy, fractures, osteomalacia, acute glaucoma and recent myocardial infarction within the last 3 months of the period. So here option A, B, C. Disease of heart, kidney, lungs, first trimester of pregnancy, fractures, osteomalacia. These all are the contraindication for the electroconvulsive therapy. Some cases for the pregnancy cases also we can do for the electroconvulsive therapy. Why? When mother are at risk of harming themselves or harming others means we can go for the electroconvulsive therapy. This is also one of the typical situation in the during the pregnancy time. Next, move on to question number 19. What is hotline? Hotline means we will see here options. Option A, care in clinics. Option B, mental health emergency care. Option C, community care. Option D, home visit. We all know what are the care in clinics, what is the community care and home visits. No need of explanation for these options. We will discuss mental health emergency care in these options. Mental health hotline are good starting point for getting help for mental illness. Since hotline operators, a crisis hotline is a phone number people can call to get immediate emergency telephone counseling, usually by trained voluntary. Mental crisis is also called as mental health emergency care. So here option B is the correct answer. Hotline means mental health emergency care. Mental health emergencies are depressive disorders. We can provide care to the some of the patient. Those are depressive disorders and bipolar mood disorders and schizophrenia and anxiety disorders. We can give a counseling through the hotline mental health emergency care. So here option B, mental health emergency care, is the correct answer. Next we will move on to last question in this video, 20. Question number 20. Which of the following medication that treat Alzheimer's disease causes slowing of the heart rate and fainting? Here from the options we can treat Alzheimer's disease causes slowing the heart rate and fainting. Fainting means nothing but to suddenly become unconscious for a short time or usually falling down some of the short period of time. Here we will see options. Option A, Tacrine. Option B, galantamine. Option C, donoprazil. Option D, all of the above. We have to know the medication that treat Alzheimer's disease causes slowing of heart rate and fainting. We have to know first of all what are the anti-Alzheimer's drugs. What are the drugs will come under the classification. What is Alzheimer's? Alzheimer's disease is also called as senile dementia. We already discussed in previous questions also. A progressive disease that destroy memory, and Alzheimer's disease is most common cause of the dementia. Here Tacrine, galantamine and donoprazil, these all are the medication we can use to treat for the Alzheimer's disease, causing the slowing of heart rate and fainting. Here option A, these are the medications also having other name also, I will mention here clearly. Option A, Tacrine. Tacrine means Cognex, also one of the name for the Tacrine medicine. Name of galantamine. Galantamine other name is Rajadine. Rajadine also called as galantamine. Here option C, donoprazil. Donoprazil is also called as Aricept. Aricept. Cognex, Rajadine and Aricept. These all are the drugs in the classification of anti-Alzheimer's drugs. These all are the drugs plus rivastigmine, the best drugs for treatment of Alzheimer's. These all the drugs are cholinesterase inhibitors that are prescribed for mild to moderate Alzheimer's symptoms. These drugs may help reduce or control some cognitive and behavioral symptoms. So here option D, all of the above, is the correct answer. This is the last question in this video. Next we will continue further question from the 21 to further questions in part 2 video, mental health and psychiatric nursing part 2. Till now we finished part 1, introduction related to psychiatric and mental health nursing, and 20 questions. Thank you for watching. Please share your opinions friends please in comment section, and please like a video. Please give your all opinion in the comment section in one comment and one like. Thank you for watching my video. Please subscribe my channel, click on the bell icon for further notification. Stay tuned.